Michelle is 18 weeks pregnant with her fourth baby.
I can barely breathe.
Are you waking up in the middle of the night, Breathless at all?
I'm not sleeping.
And what wakes you up?
It's the single most terrifying day that kid's ever experienced. You could see that he was just the wrong colour. As soon as he walked through ED, you could tell that kid wasn't right.
This morning, I just woke up and I got really bad pain.
You're still in pain, are you?
Getting worse.
It's getting worse.
2-year-old Seb has been rushed in with his mum, Cassie.
I know, buddy. Do you want to wear it? Would that be easier?
Dr. Lamar immediately gives him a nebulizer to aid his breathing.
I'm getting a little bit frightened, or if a child looks really poorly, nebulizers are what we go to first. That's really good. I know. As they walked in with Seb, you could see that he was just the wrong colour. You know, he looked a little bit more grey than a normal kid did. He was properly slumped and sort of clinging to mum. As soon as he walked through ED, you could tell that kid wasn't right. So nice big deep breaths, and that'll get the medicine where it needs to go.
Seb's lungs are working harder than they should to get oxygen into his body.
There's a point at which he'll get tired, and he'll struggle to breathe against that very resistant chest. And as he gets tired, he'll just breathe less and less. And what you're worried about then is, rather than a wheezy chest, is a silent chest. So if the wheeze stops, you're in trouble. We'll try a couple more of those nebulizers, but I think he's needing so many of them, he's going to need a little bit more of a look at for a slightly longer time we're going to manage here. Worst case scenario for Seb is that he gets tired, and at some point he just wouldn't keep up with it, and that's the point of respiratory arrest. There's something really wrong with his breathing.
Medicine. A little bit of medicine for me. Is that okay? Oh, such a good boy. We're ready. Nice and wide, all in one. We're done? Oh, good boy.
Oh, it's a good cough there, Seb.
Yeah.
And look, your
I like
breathing
them numbers a bit
still looks a
better
bit
as well.
hard. Can you see what we're looking at,
Yeah.
Mom? So he's sucking in a little bit there.
Yeah.
Seb, can you
This
tip
one
your
with
chin
your
up
arm.
a little bit?
Good boy.
Dr. Lamar is yet to see an improvement in Seb's condition.
In kids, the breathing can be the problem that's causing everything to go horribly wrong. If adults get really unwell and have a cardiac arrest, it tends to be heart-related. With children, it tends to be a breathing problem that causes their heart to stop. So, because you've got a bit of a cough and you're struggling with your breathing, we're going to give you some more of that magic medicine. So it'll help your breathing. It was just because he looks so poorly that he's getting numerous nebulizers to make sure he doesn't deteriorate.
Despite the team's best efforts, Seb is still struggling to breathe.
He's still wheezy at the minute, so chances are we'll need to do another one of those after. And I think we might just be back-to-backing them for a while.
This will make you feel lots better. Wowzers, what a superstar. You ready?
Sister Naomi and Dr. Lamar have been giving him a series of nebulizers to open up his lungs.
You've got to bear in mind that it's the single most terrifying day that kid's ever experienced. That'll be the first time he'll have come into ED that he can remember. So it's anything to try and settle him down. Do you want to see a trick?
Yes, please.
Do you want to see a trick? Where's it gone? Vanished. Do you know where it's gone? It's just appeared back there. I used to be able to put it in people's ears, but now that's a bit... It's no go anymore, is it?
Paediatric Registrar Dr. Fiona Blythe has come to assess Seb.
You will need to come up to the children's ward, and I've already told them about him, okay? Good boy. And what we'll do is we'll continue that medicine that he started on, but we'll give him a bit more time between the doses now, okay? His chest sounds better than what I believe it was earlier.
Finally, there are signs that the medicine is beginning to work.
That's brilliant. There's no wheeze there at all now, and his air entry is much better throughout. So the medicine has done its trick, hasn't it? don't want me to sit on my special trolley with you and we'll go for a ride? Yeah, together. Yeah. Oh, and then we're going to go for a big ride.
Seb's breathing difficulties were the result of a viral infection. He was kept in overnight and discharged the following day. He's now home and back to his chatty self. Michelle is 36 and pregnant.
So you've collapsed today, is that right?
I've collapsed in toilets, yeah.
So what? Tell me about that. What happened?
I've been back and forth to the doctors since positive.
Michelle thought she might have COVID, but after testing negative, she visited her GP.
Antibiotics.
He spotted abnormalities in her heart rate and sent her straight to Casualty.
So you're walking to
I
the
walked into the
toilet.
cubicle and that's the last thing I remember.
And did you feel dizzy or anything
I felt
beforehand?
dizzy and lighter.
Any pain in your chest at all?
Just a lot of pressure, heaviness, achiness. Can I watch
Have you had a cough at all?
Yeah, I've had it for the last 2 weeks.
And if you're lying flat at night, are you okay?
No. No,
See-
ridiculous. If I laid flat, I can barely breathe.
Are you waking up in the middle of the night, Busters, at all? Or?
I'm not sleeping.
And what wakes you up?
The cough.
The cough, fine.
And the fact that I feel like I'm restricted on my airways.
Michelle is 18 weeks pregnant with her 4th baby.
Right, can I get you to sit forward for me, if that's okay?
None of her other pregnancies had complications.
So, big breath in. And out. Let's have a quick listen to your heartbeat.
Just go to sleep.
Your heart is going fairly quickly. Your heart rate goes up a little bit in pregnancy, but not massively, no.
Sorry.
Sometimes with this kind of collapse in the fast heart rate and things, it can be because of a blood clot in your lung.
Blood clots are 5 times more likely during pregnancy, but that's not Dr. Staunton's only worry.
The other thing is whether sometimes when you're pregnant you can get things called cardiomyopathies, which is where you get the problems with the muscle, the heart.
Both conditions are extremely dangerous for mother and baby.
Hi, it's Emma, one of the only images. I was wondering if there's any other echo sonographers around that I could talk to.
Dr. Staunton orders an urgent scan.
She's got an echo, yeah. She's got a murmur as well, just over the aortic area.
Just overwhelmed, to be honest. Not coping with it, to be fair. Just over myself, really.
Michelle's condition is so serious, Dr. Staunton can't let her leave resus for tests.
So we're going to do an ultrasound scan of your heart. They're going to come and do the scan now.
Dr. Staunton is concerned Michelle might have a blood clot on her lung.
Is there a fall?
She needs a number of tests and scans. Radiology is the first to arrive.
Hi, love it. Is it Michelle, yeah? We're just going to be doing an X-ray of your chest area, okay? Okay, X-ray, everybody. And breathe out now, relax.
Still shattered. I've got three boys, and this one's a girl, so... And this is the last one.
Next, cardiology arrives with the ultrasound to check Michelle's heart.
Look, breath in for me. Breathe out really slowly.
Yeah.
The final tests ordered by Dr. Staunton are bloods.
What are my bloods to show? Like,
Any kind of infection, any abnormality in there. That is one of the concerns that we've got at the minute.
So, the ultrasound scan of your heart, we're waiting for the formal report, but they said it looked normal. I don't think this is a blood clot, if I'm honest. It's very difficult for us to say that anything's impossible. We sort of deal in what's likely, and I think it's very unlikely at the moment. The things we look for first are the things that are the most important. So, I think it's the more things we check off and say, OK, it's not this, that's the better it is, really. Sometimes one of the best tests we can have is time and just see what happens.
Michelle's heart rate is higher than we'd normally expect in pregnancy, and whilst people in resus and in hospital can be quite anxious and that can increase your heart rate slightly, Michelle's heart rate is higher than we'd expect in a pregnant, anxious person in resus.
I think it's probably worth keeping it in on a monitor, because sometimes your heart can go into funny rhythms which can cause you to collapse. Obviously, when you had your collapsing episode before you were in the toilet, But now we've got you on here, so if you start to feel unwell or you do collapse again, we can just get a printout of what's going on. Because I think we're still a little bit uncertain as to what exactly is going on. But yeah, anything you want to ask at all at the minute? Or
Probably definitely staying in overnight.
Definitely, I think, yeah, almost certainly staying in overnight. Definitely for the rest of the day, we'll definitely get you up onto the ward.
Michelle spent one night on the ward, where further tests revealed that she had a bout of viral bronchitis. Her heart rate has settled, and she's now back at home, resting. In paediatric casualty is 4-year-old Pippa. She's been brought in by mum Jodie.
Hello, is it Pippa? Hi, Pippa. My name's Chris. I'm one of the doctors. So you've been a bit poorly, Pippa, is that right? What's been going on then, Mum?
Well, about 6:10 this morning, she decided that she was going to be sick. And then since then, she's just carried on being sick. We've had really high temperatures of like 40, 39, but she's been sick a couple of times since we got here as well. So we're just trying to get fluid down her now, but she's still
bringing some stuff back. And the stuff coming up, is it just the fluid that she's been drinking? Yeah. Okay. And has she been complaining of any pain in her throat or any pain in her ears?
No, she did say her stomach was hurting this morning, but nothing since.
Fine. Any diarrhea?
No.
Okay. Who's this? Monty. Does Monty make you feel better?
Yeah.
Good. Right, let's have a little look at you then. Working with children can be a bit complex because you do have to work out how to communicate with them. You know, most children will say ow if you kind of poke them or, ask them does it hurt, they'll say yeah. Let's have a feel behind your ears. This is usually a good place for tickles, yeah. So working out what they actually mean, and there is a skill to that, to actually examining them and getting a lot of stuff from mum and dad. Pippa, can you do a big deep breath, like a big good, well done. Let's have a listen to this tummy as well. Let's see if I can hear your breakfast.
What breakfast?
No breakfast in there. Say ah. I'm gonna pop the lollipop stick in for a second. Oh, that's fine. So, yeah, tonsils are a little bit big, so I suggest, I suspect if she's had a little bit of a cough, bit of a red throat, it all sounds very virally. So I think we'll keep an eye on her for a little bit longer. We'll keep going with this kind of fluid trial, see how we get on. Ideally, we should just get a wee sample as well. All right, so we'll pop back in a bit.
Yeah.
You're welcome, thank you. You're very good, very brave. All right, good girl.
Thank you.
No problem.
Pippa will be closely monitored over the next hour to see if her temperature decreases and if she manages to keep down any liquids.
How are we doing?
Been sick quite a good time.
Oh, okay. Oh yeah, you have, haven't you? Oh dear.
We won't we've tried.
Just not happening. Fine. How are you feeling? You're feeling good.
There's no light in your eyes, that's why
Oh, is it? Okay. That's fine. So the reason that we keep pushing for a wee is, number one, make sure there's no infection, but also it's good to see them wee because it means that they're getting enough fluid in to make wee, basically. Because if you're not doing that, then you're definitely dehydrated and need topping up with a drip. So I think for now, I'll give the paediatric team a ring. We'll get her up to CAU, the assessment unit, and they'll just keep an eye on her for a bit longer. It'll just be more of the same for a while, and then they'll make a decision. All right. No problem.
With no improvement in her condition, Pippa is transferred to the hospital's paediatric ward.
Hiya Pippa, should we go upstairs, chicken? I know you're having a sleep.
After staying on the ward for another 4 hours, Pippa was diagnosed with a viral infection and sent home with medication.
Just found it to the lifts.
En route is another severely unwell patient. He has chest pains.
Yeah, so resus is a bit full, but yeah, we should be able to make some space and we'll see you in resus then. Thank you very much. Bye.
Junior Dr. Amber Mitchell is assigned to receive the incoming ambulance.
I've only been qualified, I think about 5 months now, so I'm still quite green to it all and quite new.
He's going to be here any second.
Starting in A&E, it's a little bit daunting, but I kind of was just ready to get stuck in.
Hey, if you just want to come straight to that end bay for us.
There's definitely quite a lot of imposter syndrome when you first start.
Pull you over here, is that
You
okay?
can do what you want to do.
Right,
1 minute.
It goes from your last day as a med student, following people around, to the next day you walk in as your first day as a doctor.
1, 2, 3. What's your name, sir?
Jeff.
Nice to meet you, Jeff. My name's
All
Amber.
right, darling.
I'm one of the doctors.
Yeah.
Do you want to tell me a bit about what's brought you to see us today?
Normally, I'm as normal as out, and I've just got this tightness in my chest at top here. And now we're thinking it might be wind trying to get up and one thing and another, you know. And then I'm getting a bit worried. Not that I was thinking of a heart or out like that. I'm on my own, you know.
And what were you doing when it came on?
Just sat as normal. And I thought, it's not right, this. So I thought, right, I'll get up and I'll make a couple of dry. That's excuse me talking, because I've had a couple of strokes and I'm really, you know.
Oh, that's fine, don't worry.
It was just the tightness on my chest, that's all. But then it won't get any worse, but it won't get any better than that.
And how long did it last for?
Oh, a good couple of hours.
Must have been quite worrying for you then today.
Well, it was.
And have you ever had any problems with your heart in the past?
I had a heart attack in 2005, that's all, you know.
Right.
Never been bothered since.
So, we're going to have a look at if you've got any old ECGs, which I think you probably will, and have a compare of them from your previous ones.
It's a few years since
to
I
see,
went into that.
yeah, to see if we've had any new changes.
Yeah.
And I think we're going to get some bloods on you as well if we haven't already.
Yeah.
And then we'll see what those results say. Is that okay? Have you got any questions?
No, love. No.
Good.
No.
Lovely.
Heart attacks can come in a lot of shapes and sizes. Sometimes it's not someone like crushing their chest and then like collapsing on the floor, which makes our job a little bit harder. And it did sound a bit cardiac-like.
With the blood results on the way, it's up to Dr. Mitchell to work out if Jeff may have had a second heart attack.
How are we doing?
I'm fine, sweetheart.
You feeling okay? Still not got any pain?
No.
Good. So I think you made the right decision in coming in to see us today. You've had a history of having a heart attack in the past.
Yeah, that's right.
And you've had chest pain today.
That's right, love, yeah.
So we've done some blood tests and we've had a look at the readings of your heart. And we think that you've had another heart attack.
Oh, right. So what happens now then?
Which means we need you to come in under the heart specialist doctors here at Barnsley.
Yeah,
For them
as an
to
outpatient.
have a good, as an inpatient.
Yeah.
Is that okay?
As an inpatient,
Yeah.
so it's keeping me in. Oh.
Yeah.
Never mind. Well, what has to be, has to be.
Have you got any questions for us?
Not really, love. No. I never thought about my heart, you know, and I was thinking it could be wind down, you know, and I'm hitting it there to make my wind come up, and you know what I mean. So, well, what has to be, isn't it, you know?
Yeah, we need you to come in.
Yeah.
So that we can make sure we get you sorted properly before we send you home.
Yeah.
We'll get you up to the ward as soon as we can get you in
All
bed.
right, well,
Is that okay?
yeah, not really.
I know.
I'm missing all my football. I've got to be right, and that's what I've come for, isn't it? Really,
Yeah.
You know?
Okay. I'm so green now that everything still fascinates me. So I'm hoping that over the years I'll be able to hold on to that. And I'm very grateful to be able to do the job that I do.
Well, if you've got any questions, just give me a shout and I'll
Yeah,
come back in.
I'm fine, darling. You'll not get problems from me.
You're not a problem. If you've got any questions, let me know, okay?
All right,
All right,
sweetheart.
best of luck with everything.
All right, lovely.
All right, nice to meet you.
Okay, lovely. Bye-bye.
Jeff spent 3 days on the cardiovascular ward, was given new medication and will attend the cardiology clinic to help manage his heart condition.
Sorry, I've had to come this way. I couldn't make it all the way around.
You've what, sorry?
Sorry, I've had to come in that way. I couldn't make it all the way around.
Okay, no worries.
Trying to get to A&E.
You're in it, but you need to get to reception. Yeah? Are you okay? You look a bit grey. Have a seat. You can just spot someone who looks incredibly sick, and he looks sick. Can I have a trolley? There's a rather grey looking chap in the back corridor. He's just walked himself in. He couldn't make it round to reception. The fact that he is staggered into A&E and couldn't make it to reception already is a red flag to me. He's sweaty, he's holding his groin. He looks pretty rubbish. Coming down a door that you don't really know where it's leading, because you're that unwell, just to be in the hospital already makes me think that's not good. Think you managed to get yourself into this? Well, I'm Chris, I'm one of the A&E doctors. Got a free cubicle. Stick him in 6. Right, Paul, let's get you up onto this bed.
With the department understaffed, Dr. Carson can't wait for help, as this patient is in too much pain.
What's been going on today then?
I've had kidney stones before. I don't know if this is
Kidney stones are pretty bad actually. Patients become quite unwell, and in some cases patients can die from a kidney stone.
I've had pain for the last two days.
Yeah.
I've been doing a lot of painting.
Yeah.
And that in house, and I thought reaching and twisting and things like that.
Okay.
And I got pain into my nuts.
And you go in testicles, okay.
But then this morning, I just woke up and I got really bad pain in my back.
Yeah.
And it's more on left.
On left as well.
Here, and I've never had it in here before.
Okay, so it's just in there.
That's probably the worst part now.
Yeah. And is the pain there all the time, or does it come and go?
No, it's there all the
Constant.
time.
And is it the same all the time?
Really sharp.
Sharp.
I feel as though I passed water, and I feel as though I can't.
When was the last time you had a wee?
About an hour ago.
Hour ago. Did it sting or burn at all? Did you notice any blood in there? No. Okay. Let's have a quick look at you then. So, is it okay if I just lay you down for a second?
Yeah.
If you need to be sick or anything, just let me know. We'll get the bowl for you. All right. So is that hurting just where you're pointing there? When was the last time you opened your bowels?
A couple of days ago.
A couple of days ago, okay. What age are you?
52.
52. I think what we'll do is we'll get a cannula into you, get some blood tests, and we'll give you some painkillers. All right, is that okay? Good stuff.
Paul is sent for an urgent CT scan to determine if a kidney stone is causing his extreme pain.
Let me see if I can see anything. He's got a little stone there. Just there, should be a tiny, tiny little stone. Yeah, the rest of it looks okay. In most patients, these pass themselves. So most patients will actually, it'll fall out of the tube and the patient will just wee it out. But in Paul's case, it seems to be a bit stuck in the tube, and that will be what's causing his pain because the tube is trying to squeeze the stone out. Hi, Paul. You're still in pain, are you?
Getting worse.
It's getting worse. So it looks like you probably do have a little stone in there, all right? So what I'm gonna do, we'll give you more painkillers. I'll ask the nurse to come back and give you some as an injection. And we'll give you some anti-sickness as well. No, I'll get you a bowl, don't worry. Here you go. Better out than in. We'll give you some anti-sickness, all right? Okay. Hold on. Horrible. Is the pain still in the same place?
It's all right. In the pit of my stomach.
Yeah. So you've got, yeah. So yeah, so you've got a little stone just in the tube that connects your kidney, which is back here, to your bladder, which kind of comes around toward the front. So that'll be the culprit. That'll be causing this pain. In most cases, it falls out, but in some cases, we have to ask the surgeons to kind of go fetch it, all right, with a little kind of camera. So we'll give you some more painkillers, give you some anti-sickness, and I'll ask the surgeons, the urologists, to come and have a look at you then, all right? No worries. We'll get you sorted out, Paul, okay? Stones are horrible. I would not want a kidney stone. So I drink as much water as I can to try and prevent that. So hydration is the best way to prevent kidney stones.
Paul was monitored overnight before being discharged. Medication helped him safely pass the stone.